Here with me is Dr. Timothy Jochen of Contour Dermatology, here to talk about a cool new way to reduce small areas of fat on the body. Thanks for joining us this morning.
My pleasure.
Tell us a little bit about CoolSculpting.
Well, CoolSculpting is a non-invasive way of getting rid of fat. And I'm a huge fan because everyone wants something non-invasive.
Yeah.
So,
nobody likes to be poked and prodded, right?
I know, particularly you.
No, I'm not. I mean, I don't know if you've seen, but I've done the acupuncture on air. I mean, it was like one spot, but I will do it sometimes. I'm not a poke and prod
Well,
fan.
this is for people like yourself who are a little bit intimidated by invasive procedures. So this is just a little vacuum that sits on your skin. It sucks up the fat, and at the same time it freezes it. And the thing that's great about this is it melts away the fat permanently.
Okay,
with
so
each treatment.
Explain. How does it actually like suck it away out of your body without being invasive?
Sure. Well, it's not sucking it away. It's just a device that has a small suction on it. So what it does is it basically, we put it on your skin, it sucks up just a little bit of skin, just like that.
I'm trying to flex. You're supposed to show that off. Thanks
So,
a lot, Dr. Jochen.
Well, you know, and the thing is, it actually is for areas like this, which you have almost none. So
well,
you wouldn't
thanks.
be a good candidate.
Yeah.
But for other people, you know, it's really nice because it is completely non-invasive. So it's just a little bit of suction, and then it freezes it. So it feels a little bit uncomfortable, but it's really not that bad.
Not bad at all. Okay, so how cold does it get?
Oh, that's a good question. Very cold. Cold enough to melt the fat cells. I'm not sure the exact temperature, but...
Is it going to be too cold to bear? Because I mean, I've seen like the machines that you have to get inside and it's freezing inside, but like this isn't like that. This is one of the
not like that at all.
Okay.
Really, it's just more a little bit of pressure, and then you start to feel, oh my God, this is getting chilly.
Okay.
But you know, it numbs it up as it freezes it, and so it looks great. And you can see here some arms where you see a dramatic difference
some good
in
looking
that
before and
hanging
after.
fat. So it works really well, and it was developed for small areas because we've had the CoolSculpt for several years now, but they keep making new heads which make it more applicable to different areas like the knees, the back of the arms, you know, the bra fat. We have one for underneath the chin. So
a little bit of something for everyone.
For everywhere in your body now, yes.
All right, well, good. Well, is there anyone who maybe should look into a different procedure like that this could be risky for, that they need to talk to their doctor about before deciding to do this procedure?
You know, there are very few people that we have to turn away. The only people that I've actually had to turn away are people that have hernias. So if you have had a surgery in that area where you want to do the CoolSculpt, then you have to be cautious. But you know, it's a very safe procedure, so almost anybody's a candidate. Now, if you're very, very overweight, you may want to consider doing something else like bariatric surgery or an extensive diet or something like that. But for most people, it's a great option.
So is this something that someone could just make an appointment with Contour Dermatology and walk in and do? Is that a possibility?
We do walk-in consultations, and we have appointments in the evening and on the weekends. And so when you're ready, you come in and we hook you up to a machine. And we actually have 4 of the machines.
Wow, very cool. Well, all good information. If you're interested, you can always look into that at Contour Dermatology. Thanks so much for joining us this morning. We really appreciate it.